Good afternoon. I'm Amy Douglas, the Chief Mom Ambassador here at Mom's Meet, and I am so excited that you all could join us for our webinar brought to you by Xlear. During this webinar, you will learn more about xylitol, a plant-based dentist-recommended sweetener. So let me introduce you to the presenters for today's session. First, you'll hear from Brian Craig, who has been working for over 30 years in the healthcare industry and has a wealth of knowledge to share with us. He's been with Xlear for over 7 years. And then you'll hear from Dr. Chris Kammer, who's been in dental practice for a long time and is a well-known advocate of the oral systemic approach to dentistry. So if you have any questions during this presentation, feel free to type them into the chat window, and we'll have some time at the end to answer all your questions. So with that being said, Brian, please take it away.
Well, thank you very much, and I want to let all of you know that it is a pleasure to be involved with you today, and I appreciate your interest in finding out about xylitol and this important, frankly, tool that I think you'll be able to use in helping to promote better health. Just to give you a quick background, our company has as our mission specifically to focus on xylitol products. We saw very early on the great benefit of this product, and I know that the name xylitol sounds chemical or artificial, but in reality it's viewed most often as a natural sweetener, but it has some great healthy benefits. And we wanted to go through this presentation, give you an idea of some of the background, but there is a lot of information that we could give you. And so we're going to go a little bit fast with this. Hopefully, if you've got questions, you can give those to us so that we can try to address those at a later point in the presentation. But as well, we encourage you to really take the time, even after this seminar, to inform yourself about xylitol and to see the ways that it can actually be incorporated into the life, to your life, and also into the lives of your children and your family. Basically, as I mentioned, xylitol, the name, that first part of it, the XYL, comes from the Greek word for wood. And you may remember, or even you may be teaching your children, and always in the alphabet situation, you always try to come up with what words do you come up with X. And xylophone is one that often comes up. Xylitol is another one you'll now have. Both of them come from that same Greek form, meaning wood. And so originally, xylitol was something that was isolated out of birch wood chips. Now, the first question is what are the amazing health benefits of all-natural xylitol? I mentioned that besides it being used as a natural sweetener, being derived from plants, it has some great benefits in general. And basically, there are three main areas that xylitol has been used very extensively for. Our company started out using and promoting xylitol for upper respiratory health and being able to be used in a nasal spray to help clean out and moisturize the nasal passageways and keep those healthy. There have been a tremendous number of studies that have specifically gone into the oral benefits of xylitol, and that's something I'll focus on in just a little bit. And then another area that has been very well researched is the benefit that xylitol has actually for diabetics and for people on sugar-controlled diets. As this final point on the slide indicates that the research into xylitol is ongoing. A lot of times people think that maybe this is a new item that's come out and that there's maybe not as much information, but actually there have been over 2,600 studies published just on xylitol and its health benefits. Let's get into a little bit of the history of xylitol. As I mentioned, xylitol has been around for a long time. It's a natural product, but it was actually first isolated and discovered over 100 years ago. And its usage really started to happen quite a bit during World War II, in particular in Finland, when the Finns were not able to get regular supplies of sugar in. a lot of the villages started to use a birch sugar, or a sugar that they were, a sweetener that they were deriving from the tree bark. And that led to a lot of studies being conducted on it, especially after the war, because the researchers noticed that those villages that tended to use more xylitol than regular sugar in a lot of their cooking and in their sweets, that they actually had much better dental health than villages that had ready access to regular sugar. So this led to a number of very, very good studies, and the Finns in particular were the first group that started using xylitol as a sweetener in chewing gum. Nowadays you can see a number of different chewing gum companies which will tout the fact that they have xylitol in their product. But one of the things that's very important for you as consumers to do is to look carefully at the ingredient stack, and xylitol should be the very first ingredient, and ideally the only sweetener in it, because some of these studies actually indicated that when other sweeteners are added in, you lose some of the benefits of the xylitol itself. So where does xylitol come from? As I mentioned, xylitol is natural. It is generally found in the fibrous portions of plants. Today, commercially, it actually comes from a part of the crops generally that are thrown away, that very fibrous portion of either the corn stalks and corn cobs. It still comes from birch in some instances, but there are a lot of other sources that are now being developed from parts of crops that are being thrown away. So it's actually a very useful thing from that standpoint. An interesting aspect is also, though, that our bodies produce xylitol. On a daily basis, our bodies produce between 5 and 10 grams of xylitol, and it's used in a normal metabolic pathway. It's used in generating energy and in absorbing different types of minerals into the system. And so it plays an important role. It's something that your body is used to and that your body uses on a regular basis. Xylitol as a sweetener is just as sweet as regular sugar. In the measurement scales, they normally say it's about 97% as sweet as regular sugar. It is a nutritive sweetener, meaning that it will give some calories, but it's generally 40% lower than regular sugar, so you've got the advantage of lowering the calories, but still with something, unlike a lot of the artificial sweeteners that are 0 calories, this one has benefits for the body, and it's something that, again, your body can use. So the differences between xylitol and regular sugar: first and foremost, xylitol is a 5-carbon sugar. Most other sugars are actually 6-carbon. And that difference between xylitol having a 5-carbon structure and regular sugars having a 6 is very, very important. Primarily, this difference comes into play because bacteria, either in the mouth or in the nasal passageway, readily break down 6-carbon sugars, make acid, or they convert it into a biofilm that becomes plaque. But when they're exposed to xylitol, they can't break that down and they can't metabolize it. This question, and Dr. Kammer may get into this a little bit more in depth, is how do bacteria cause cavities? Again, as I mentioned, bacteria readily will take in different types of sugars, and they will use that to produce a biofilm, and as part of that process, as they're breaking it down and metabolizing it, they produce acids. The acids in particular, as they sit up against the enamel of the teeth, will start to cause a demineralization, or the minerals basically being removed from that enamel surface. And the bacteria also create a biofilm that becomes plaque, and it becomes a hardened tartar, and problems that, again, hold that acid against the tooth enamel and create further problems, in particular with the gums and with the general health of the oral cavity. Xylitol, as we mentioned, has an interesting effect on bacteria. First of all, strep mutans, and you'll hear a number of things on that. That is a particular strain of bacteria that is very prevalent in the mouth, and it's the one that is most responsible for cavities. Those bacteria recognize xylitol as a carbohydrate, as a food source, and they try to take it in, but because they cannot break it down, they end up losing that ability to make that biofilm, to make the acids. In fact, it's kind of like putting a key into a lock that fits into the lock but then doesn't turn. As long as that key is in the lock, you can't put anything else in there. And likewise with the bacteria, when they have taken in xylitol, they cannot get any other bacteria, or they cannot get any other carbohydrates into their system, and as a result, it inactivates them. It doesn't actually kill them, but it inactivates them to the point where the body's own immune system can start to handle them a little bit better, and they cannot cause the damage that they normally would do. Again, you can see here some of the effects that xylitol has and how it helps with starting to protect the system and encourage better health. Interesting to note is that a lot of people think of tooth decay just as a problem of just growing up. It's something that happens naturally, and yeah, you try to control it, but in reality, you're never going to get rid of it completely. It's sad to note that tooth decay, especially in young children, is the most common infectious disease that occurs in our society today. And in fact, a lot of researchers have referred to it as a pandemic infectious disease. In Finland, where more xylitol is used, interestingly enough, though, the rates of tooth decay are very, very low. In the United States, wherein they say that over 80% of children will experience at least one cavity in their growing years, in Finland, it's less than 20%, so a dramatic turnaround. Speaking of research, and I'll just run through these very quickly to allow Dr. Kammer a little bit more time. As I mentioned, there have been over 2,600 studies, but specifically the studies show a link between dental health and overall systemic health. One of the first really in-depth and really important studies that were conducted on using xylitol, in particular with children, was a study that was conducted in Belize in Central America. And the University of Michigan went down and worked with young school children, in particular those that were just having the first permanent teeth erupt. And they started using just xylitol-sweetened chewing gum with the children, a very simple thing, not using any other medications or other intervention types of things, but getting these children to chew the xylitol-sweetened chewing gum several times throughout the day and watching the effect that they had. As you notice in here, the researchers discovered that xylitol had a dramatic effect on the microflora that were in the children's mouth. The teeth actually were able to recalcify, and it showed that the xylitol helped increase the calcium absorption, and it strengthened the tooth enamel, plus it dramatically reduced the caries rates. 5 years later, a follow-up study was conducted by the University of Washington. They went back and were working with those same exact children, and they discovered that they still had a 70% reduction in overall tooth decay among those that were using the xylitol-sweetened chewing gum versus those that were using the sorbitol, which is the most common sweetener in sugar-free chewing gums. The Isokanga study was a study specifically on another aspect of xylitol, and that is that when children are born, they have no strep mutans bacteria. And where they get those bacteria from are from the mothers or the family members as they're kissing the child, as they are sharing food with the child, that they transfer then the strep mutans in the mother's mouth to the child. And what this study was specifically looking for is a way of controlling that transference by either feeding the mother xylitol to weaken the strep mutans so that they're less apt to be able to transmit, or giving xylitol to the children and then making it more difficult for the strep mutans to colonize and implant the child's mouth. And so they did these studies over a long period of time, and these studies have been replicated in a number of different countries as well. And they compared against using a couple of other common dental practices, either fluoride or chlorhexidine varnishes, and they discovered that in all cases, xylitol was far superior. It worked on many different facets of the prevention and was much more effective at preventing the transference of the strep mutans into the child's mouth. And long-term on these studies, they discovered that the rate of tooth decay in those children that had lower strep mutans bacterial levels was dramatically better. And so as a result, in Finland today, a lot of the schools actually require children to bring xylitol sweetened chewing gum that they can use to follow up after snacks and after meals as a way of specifically preventing and preventing cavities and improving overall oral health in the children. And that's one way that they were able to reduce the caries rate so dramatically. Here in the United States, despite a lot of programs that we've put into place and a lot of the awareness, we still have very, very high caries rates among our children. And it's quite frankly disappointing, and I know a lot of dentists in particular have expressed frustration that it seems that there's got to be a better way. And that's one of the things that we've been hopefully exposing you to, is the fact that xylitol does give a great option for a lot of these types of things. Now, generally, the optimal use of xylitol, as I mentioned, because it doesn't actually kill the bacteria, but it inactivates them, the studies have time and time shown that the best way is multiple exposures throughout the day, that in order to keep that bacteria from getting ready access to the other types of sugars, that it's good to have multiple exposures to xylitol. So hence the mantra that we've been trying to put out is try for five exposures of xylitol a day. And actually, it's not that hard. It sounds like a lot, but it's an easy thing to achieve if people are using xylitol toothpaste, xylitol mouth rinse, or gums and candies. And it would be easy throughout the day to get that exposure and see those dramatic results that can happen from regular usage of xylitol. Basically, again, I apologize for running so fast, but I want to give some time to Dr. Kammer. As was mentioned, he has been very instrumental in trying to get the message out of the oral systemic connection of bacteria in the mouth with the rest of the system. And in fact, he's even gone to great lengths, and he may mention some of that, even being on American Idol, for example, and talking to people about the importance of oral health and how that has an effect on everything else. So with no further ado, I'll turn the time over to you, Dr. Kammer.
Thank you, Brian. Well, as you mentioned, I will go to great lengths to get the modern dental message out there, because I fear, and I'm quite certain, that we're a long way from the understanding of all of the good things that modern dentistry can bring to our lives as far as health. So not only will I go to American Idol with a message of oral health, I've founded the American Academy for Oral Systemic Health. We're almost up to 600 members now. And when I see something going on, or I come across something that's really, really helpful and beneficial for our nation, for our world, I get really, wow, I have a hard time not being, I can't be quiet about it. I have to make some noise. And so it's a pleasure to speak to the mom ambassadors and everyone else who's enthusiastic about health and xylitol on this call, because you also can help educate the world, because there's a big, wide world out there to educate. And my feeling is, you know, we've got to change. The answers are in our hands. There's no need for people to have, for young people to have tooth decay anymore. They're with xylitol and with prevention methods, we can keep people from getting cavities. So I want to talk a little bit about that today. You can go to the next slide there, Brian. And first of all, since I'm talking to the mom ambassadors, I have to talk about my little miracles. These are my kids. Through the miracle of adoption, I have 4 children, and one of the most exciting things that I ever did was put them all in my arms and go for a walk. So that was a few years ago, because if you look at the next slide, they're a little bigger now, and I can't quite carry them all. I have them carry each other actually a little bit. I get a little more help on that. But I've been fascinated with keeping my kids cavity free, because they are all genetically different from me, and yet we've been able to keep them all free from the shot, the drill, from cavities their entire childhood, and we use all the modern methods that dentistry has, and xylitol is a big part of that. We'll go ahead and move on. Next is, to get the attention of my colleagues, I figured, okay, they need to know about xylitol. By the way, if you have a dentist that is aware of xylitol, fantastic. If they're selling xylitol toothpaste and products in their office, even better. That's a very progressive dentist. If they're not aware about xylitol, you might want to share this article with them. And I will send this article to Annie. I will send it to you, Annie. And Annie, any of your mom ambassadors would like to get a copy of this article, you can send it on to them. Now, I brush my teeth with sugar. I absolutely do. But this is the sugar that's good for your teeth. This is, of course, what is it? Next slide. It is xylitol. Absolutely. And this natural sugar is a part of my everyday routine. And I tried to get my dental colleagues' attention, and title this article that I brush my teeth with sugar, to get them to raise their awareness about xylitol. And I do. I use xylitol in my toothpaste, but I also take straight xylitol and put it right into my mouth and let it dissolve and swish around. And all these various methods to get my 5 exposures of xylitol a day. So this will, if you need more takeaways from this discussion, this article is a great one to have, and you'll want to share it with your dentist to help educate them. You'll want to share it with your neighbors, because people that are aware of xylitol realize that you've got the golden treasure at the end of the rainbow that nobody else has, and you can help educate your community and other mothers and your dentist and your hygienist. It's shocking to me how this isn't just common knowledge in the profession of dentistry, how it should just be on the cover of dental magazines. In fact, for its ability to help prevent tooth decay, it should be on the cover of Time magazine. So I'm encouraging everyone to be the missionaries for xylitol. Once you've learned about it, you've got to tell people. We'll continue. The thing about xylitol, now Brian did a great job of talking about all the oral health benefits, and as the founder of the American Academy for Oral Systemic Health, I am trying to teach my colleagues and the medical community and the public at large with this organization that our mouth health impacts our body health. Oh my goodness. And one of the most amazing things that I've come across is that these strep mutans that xylitol changes and inactivates, which is so good because they've now been shown that that they're considering that they're participating in the beginning of heart disease. So xylitol not only prevents decay, but now they're looking at it as the possibility that it's preventing heart disease, because when they find these bacteria, these strep mutans that originate in the mouth, they find them in the lining of the heart. And in those vessels, they're kicking out a lot of inflammatory factors that increase your risk for heart disease. So this is a huge news. And so it's a whole body health that we're talking about, and not just your mouth. So I want to bring that important information to everybody. And it's and as Brian mentioned, and a very, very important fact is that you're going to see other products that say we contain xylitol, but you really got to go for it. It's kind of cut off on the slide there, but you're looking for 100% xylitol to the rescue. That's what that slide says. And if you mix it with other sweeteners, it's not going to be as effective. And this 100% xylitol is what's fighting tooth decay and possibly heart disease as well. And there's a whole slew of diseases, which I'll cover in a second here, that that are impacted by your mouth health, which, you know, xylitol is going to improve your mouth health. So it's a whole body health that we're talking about. Go ahead to the next slide. You know, one of the products that says they have xylitol is Trident, but don't be fooled, because that's the fourth least. That sweetener xylitol is in the fourth least amount. So it's got sorbitol, mannitol, and mannitol, and those can inactivate the xylitol. In fact, some of those sweeteners also can promote decay. You didn't think about that, did you? You just think that if it's sugar-free, it's always going to be healthy for your teeth. Not necessarily. So go with 100% xylitol always, and watch for those ingredients, just to reiterate what Brian so appropriately said already. We'll continue on. The thing is that that a lot of people aren't aware is that, yes, Brian mentioned this as well, that tooth decay is a transmissible disease, and if you're kissing your babies, or you're sharing their food, or a real popular one is, the pacifier hits the ground and somebody picks it up and licks it off and gives it back to their child. Well, there goes the bacteria from your mouth setting up shop in your child's mouth, and once it sets up shop, it sort of stays there, and so your best bet is then to try to control it. You want to do everything you can to keep it from getting there in the first place. Mom and dad's use of xylitol is imperative to knock down and inactivate the strep mutans that are in their mouth. That'll lower the chance of transmitting it to their child. But of course, once the child is able to start with xylitol regimen, absolutely want to get them going with it as well. We'll go ahead and continue. We always want to strive for 5, and Brian mentioned that. So 5 servings, it's pretty easy to do when you think about all the different products. All right, go ahead and to the next slide. I'm seeing slide. Oh yeah, this one's an awesome slide, because this is one of the dentists from that wrote for the Journal of Dental Education that the studies, I mean, those that are in the know, are so in advocacy of xylitol, and they're saying that that xylitol consistently shows that it's superior in decreasing the risk of cavities. So this isn't even controversial. This is, those in the know, and unfortunately not enough are in the know, but they feel very, very strongly about the power of xylitol. And I, as someone who likes to carry the banner of modern dental health, try to be a loud voice for xylitol, because it's so important. And that's what everybody else can be on this call. We'll go to the next slide. But here's one of my favorites, because Catherine Hayes also went on to say that, and I believe she is a Harvard educator, that this is a big one: it would be unethical to deprive your subjects or your patients of the potential benefits of xylitol. So this is where I really try to aim this at my colleagues in the dental world, saying, hello, dear colleagues, if you aren't educating your patients about xylitol, it is unethical, and I stand strongly on that statement. So it's not just, oh, this is an okay kind of good thing to do. It's unethical. And I will say it. Catherine Hayes has said it. It's appeared in the Journal of Dental Education. But this was, many, many years ago. Xylitol has been around a long, long time. It's not taking over the country fast enough. And that, as you can tell, folks, gives me a little anxiety. But I am hoping all the mom ambassadors will take it to their dentists and take it to their neighbors and their friends. So think about this, though. This might be part of the problem. How much money do I make from filling cavities on the patients that are on my xylitol protocol? How much money do I make? Well, what would the answer to that? Well, the answer is a big fat zero. Zero, because they are on a xylitol protocol. They are on a protocol that's keeping them from getting cavities. So it kind of goes counter to what every dentist has been taught to do. You get a little cavity, you got to get in there and cut it out and fill it. But now we can remineralize teeth, we can heal teeth. Xylitol is a part of that protocol, but let's get them on, let's get everybody on it right away, so we don't even have to worry about these early cavities. The hard part, though, is it's not necessarily a money maker in the dental world, and sometimes it's hard to get their attention, but it is everything that everyone should be doing. You know it's right, and as a medical health professional, you've got to tell people about it. So that's that about xylitol. Go to the next slide then, please. So yeah, I'm thinking that it's the right thing to do. I would prefer to not ever have to fill another cavity in my office. I would prefer to have the nation's most progressive cavity preventing practice because that technology is here, and the xylitol is here, and there's no need for anyone to get a cavity. And gum disease as well. And you talked about two of the top diseases affecting mankind right now. Guinness Book of World Records puts gum disease as the #1 inflammatory disease affecting the body. Go ahead and you can click that there, Brian. And so it's really time to do something about that. So I'm a huge advocate of fighting tooth decay and gum disease because we know that these problems, the bacteria that causes tooth decay, the bacteria that causes gum disease, it's taking us down, people. And with a country that is on the verge of bankruptcy and that we can't even support, or we're having a hard time affording health care. Let's get working on the front end. Let's not be a one that tries to fix the back end because everyone's falling to pieces and we've got gum disease and tooth decay and heart disease and stroke. Let's put our emphasis on the front end, and that's why dentistry is here to help the whole body, and we're doing it on the front end. Go ahead, Brian. You can continue. So let's see. My slide got a little interesting there, but we can go back to that slide because I think I can read it. Oh yeah, basically what that slide is saying that the American Academy of Periodontology last year said as big a problem as we know that gum disease is, and the Surgeon General says 80% of the population's got it, it's even higher than that, maybe 2 to 3 times higher than previous estimates. It's a very serious disease. Go ahead, Brian. And now this is maybe the most shocking and scary slide of all, but that's why I founded the American Academy for Oral Systemic Health. That in the average general dental practice, over 90% of patients with existing gum disease go untreated. Now that sounds very, very scary, but there's a lot of, if your gums are bleeding during your cleaning, you have gum disease, and it's not good enough to just wait another 6 months for a cleaning. And you have to be your own advocate in the dental office. You've got to be an advocate for gum health, and you have to ask them, do I have gum disease? Because if you do have gum disease, the very definition of the cleaning that you just got shows that it's an inappropriate treatment for people with gum disease. You need gum therapy, not a 6-month cleaning. I'm kind of getting on my soapbox here about the sorry state of dental health across America, but there's so much more that dental offices can be doing, and they should really have a zero tolerance for bleeding in their offices, and if people's gums are bleeding, they need to get on periodontal therapy and a protocol that would include xylitol, among other things, to improve their health. One of the interesting things about xylitol is that when Brian said it inactivates this bad bacteria, it actually changes its morphology or its shape, and it can't clump together as well, and it can't stick on the teeth as well to create dental plaque, and dental plaque is one of the precursors to gum disease as well. So, xylitol, I just love it. But there's more that we can do as a practice. All right. So if you have bleeding and you're still getting 6-month cleanings, and your dentist is just telling you to floss more, don't just say okay. Say, well, why? And they'll say, well, they might say you have a little bleeding. Usually they underplay it. There's no good. A little bleeding is not a good thing. A little bleeding is gum disease, and once again, gum disease requires therapy beyond a 6-month cleaning. I'll get off that soapbox. Go ahead and continue there, Brian. But I get a little passionate about it because, oh my goodness, we've got to make this oral health situation better because it's very, very serious, And these are just some articles that have come out in the mainstream media. But if you have gum disease, you're twice as likely to die from a heart attack and 3 times as likely to die from a stroke. Now, that means that the health that's going on in your mouth affects your overall body health. This is not a secret anymore. This information has been out there, and it's been out there in mainstream journals. So I want to get everybody to care very, very much and very passionately about the health going on inside their mouth. And this has been reported in other journals as well. Consumer Reports will even tell you that preventing gum disease is gaining a new urgency. Boy, if I don't sound urgent on this phone call, I'm not doing something right here, because very passionate. And it is an urgency, especially in light of this healthcare crisis that's going on in our country right now. And we're about to go bankrupt, I'm afraid to say. I still don't know how they're going to solve the healthcare crisis in this country. But while they're trying to figure it out, let's do everything we can on the front end to be preventatively healthy, and xylitol is part of that, and getting gum disease under control is a part of that as well, because it's connected to diabetes, heart disease, stroke, and pneumonia. Is there a diabetic crisis in this country right now? You better believe it, and it's getting worse and worse every year. We'll continue on. One of the good things about xylitol, by the way, is that it doesn't raise your glycemic index, so it's great for diabetics. So xylitol reduces plaque, and the plaque bacteria, if it can't stick on your teeth, it can't digest that xylitol sugar like it can normal sugar, and it turns that sugar into acids, and it allows the plaque to stick to teeth. So I just love xylitol. It's a sweet, cool, and delicious way to get a better health. And so I say, and I encourage everybody out there to xylitol your way to better whole body health. And I'm so happy that now I'll turn it over to Annie, and Brian and I would be happy to take questions from your listeners, or if you want us to continue in any particular area, Annie, we certainly can. And I've really enjoyed this opportunity to share the good news about xylitol and the importance of oral health as it applies to our whole body health. Boy, it's almost not even about saving teeth anymore. Even though it is, it's a whole body health that we're after.
Thank you so much, Dr. Kammer. That was a wonderful presentation. And Brian, thank you so much for your part of the presentation as well. Yeah, so we'll go ahead and move into the Q&A session. So everyone, if you'd like to type in your questions in the chat panel, go ahead and do so. So we'll get started. We already have a lot of great questions that have come in. So this question is for you, Dr. Kammer. Do you have any tips for moms on kind of, the top, 1 or 2 best ways to prevent cavities in young children, other than, of course, incorporating xylitol into the mix? But do you have any other kind of top tips that you could share with our moms?
Well, absolutely. No, certainly one of the things that they don't think of is that, and this is kind of new information, although I'm sure you're very aware, mom ambassadors might be on top of this, but the new standard is dental home by age 1. So really, everybody should have all children by age 1 should have a dental home, and so that's really up there. Even when the kids don't have teeth, there are these little spiffies that they can use that you can be swabbing the gums, and even if you don't have a little spiffy, on a daily basis, you want to be just gently, you can even with a wash rag over your finger, swab over their gums, because they'll develop a plaque and the bacteria start forming right over their gums on a daily basis. Certainly, back to xylitol, you wouldn't think that what can I do, what's the best thing, one of the best things I can do for my child is get my own dental health in order. And, so xylitol usage by mom and dad, making sure that their teeth are healthy, that they're not harboring bacteria that can be transferred to their kids is very, very important as well. Another big one is a lot of people put their babies to bed with a bottle of juice at night, and you have to be aware that that any kind of complex, any kind of carbohydrate like a juice or a sugar, a sucrose type sugar, is going to feed the bacteria in the mouth, and that's going to create acid production that's going to peak in 10 minutes. Well, if they go to bed with a bottle in their mouth, every 10 minutes it's peaking, or what I'm saying is that peak level, that highest level of acid production is going strong continuously. So that's why that there's such a thing called nursing bottle caries or cavities, that kids that go to bed with a bottle, or that they always have a bottle in their mouth, end up with terrible incidence of decay because the acid level is always so high. So those are a couple big ones right there.
You know, if I can just jump in just really quickly, there's some things as well. There were some studies up at the University of Washington, and as Dr. Kammer indicated, getting some of that xylitol in the child's mouth, even at that young age, will do a couple of different things. But they were even just using a xylitol gel that is readily available, but that alone did two things. Number one, it kept that bacteria down, and as Dr. Kammer indicated, it kept that plaque from building up on the gums. But more importantly, it actually increased the way the calcium was laid down in the enamel of the teeth as those are forming in the jawline. And so as a result, the teeth became that much stronger and also more resistant to the decay. So you're helping on two fronts with that, controlling the bacteria, keeping that acidity down, but also being able to help strengthen the way that the enamel is forming also.
Mm-hmm.
And I also would like to mention that there's this great product that we sell in our office, and it is comes from the Xlear company, SparX. Tooth gel, and it comes in this little package with the banana brush. Now the banana brush is a very soft plastic little brush, and every dental office in the country should be selling these. And when parents find out about these, they scoop it right off our shelf. And you put the gel into the little banana brush, and the kids can carry it around. It's a very safe little brush. If they were to fall and fall on their brush, or they can't hurt themselves with this brush, is what I'm saying. And a little bit of the gel will ooze out of it as they nibble on it or bite on it or use it as a pacifier, or even pretend to brush their own teeth with it. A great product to introduce your child to the xylitol as well. So definitely look into that.
Great. And we have a couple of people wondering, about maybe potential side effects. Are there any known side effects of xylitol, and can you have maybe too much xylitol intake?
You know, interesting, as I would raise that question, xylitol is considered a sugar alcohol, and you'll hear a lot of people talk about that, or chemists now refer to it as a polyol. And what that does is it's a special group that, unfortunately, some of them in that group, like maltitol and mannitol, create a lot of gastric problems, a lot of bloating, a lot of gas. Xylitol generally does not cause those types of issues. There may be somebody that's a little sensitive to it. But what xylitol does is, and you'll notice that if you ever take xylitol and put it right in your mouth, as Dr. Kammer said, it'll increase salivation and it'll bring a lot of moisture to itself. It tends to hold on to that moisture. So if you use xylitol in something that's got that needs a lot of sweetening, or if you take a lot of it, and generally when we're talking about a lot, you're talking with a child of probably about 5 or 6 teaspoons full. And you generally, in your normal usage, wouldn't be giving that much to them. You may get some transitory diarrhea. Now, and the reason I bring that up is my daughter is a pediatrician, and as she's worked in her practice with a lot of parents, and they complain about their young children getting constipated, she's actually encouraged them to use xylitol in water to help relieve some of that constipation, because again, xylitol is something your body normally produces. You've got a normal metabolic pathway for using it, so it's not a foreign substance you're bringing into the system. But in those situations where they would just mix the xylitol up in water and give it almost as a sugar water to the children, it'll help bring extra water and fluid down into the lower intestines, and it just creates that relieves that constipation from that standpoint. So that is generally the only known side effect to using xylitol.
I'll chime in on that too, because xylitol is so powerful in such a small amount for its oral health benefit that to me, a lot of people say, well, I can put this in my coffee, or I can make a half a gallon of lemonade with it, and I will just relate the story that my hygienist made a half a gallon of lemonade with it. Used a cup full of it in the lemonade and downed it with her husband and their child. and that did give them all a significant case of diarrhea, I will say. So, you know, you have to kind of watch it. I mean, in the right amounts, it's perfect, and you have to use a lot of it to get it in the wrong amount. But I would, you know, watch out for that. And I don't even steer people towards baking with it or, you know, trying to get it, because it's like you have to use so much of it to, you know, in some instances for the proper amount of sweetening. But a little bit of it, I mean, just straight or in a mint or a gum form, it's just perfect. The other thing I'll say is that that xylitol is definitely must keep it away from your pet dog, and that can be very, very challenging. Can make them very sick or even kill them. You've got to keep the xylitol away from it. First, now it's perfectly natural for humans, but for some reason, like some of the things that dogs can't consume, whether it be grapes or chocolate, makes them very sick or can even, you know, harm them greatly. You want to keep the xylitol products away from the pet dog. Is that pretty much your understanding as well, Brian?
That's definitely it, and the reason why is the dog's body doesn't recognize it as xylitol. It thinks that it's glucose. It starts secreting insulin, and so it is a little bit of a problem. And some dogs have more of a problem than others, but we always urge people, keep it away from your pets. Yep. Yeah.
Great, great. Now we have some questions about fluoride. Should xylitol be, I mean, can it be used as a replacement for fluoride, or should it be used in conjunction with it? What do you recommend?
I can speak on that. One of the, you know, great things about xylitol, I think you can choose your own option there, and let me explain. Xylitol does increase mineralization, and I think it allows. It accommodates that by decreasing the acidity of the mouth. If you can lower the acidity in the mouth, you'll have a higher uptake of minerals into your teeth. Having said that, if you are a fluoride user, now we have minerals in our mouth. There's lots of calcium minerals already in our saliva. So if you want to do the, you know, the natural uptake of minerals, that would be a way. If you want to enhance it even further, and you're okay to take to use fluoride, you'll get an even greater benefit of uptake of minerals and fluoride into your teeth. Now, I have found that that I have patients that go on both sides of the fence. Some prefer not to go with fluoride at all, and some are just fine with fluoride. So I try to live in the real world where I can advise both sides of the fence and still keep everybody happy. And I think you can do well either way. And I hope that answers the question.
Great, great, yeah, definitely. And we have one person wondering if xylitol might have any teeth whitening properties.
Brian,
yeah, if I can answer that one, yeah. You know, xylitol itself won't whiten the teeth. Now, it'll have a couple of good effects from the standpoint, if you reduce the amount of plaque that's building up on the teeth will naturally look a lot whiter, and especially, as Dr. Kammer indicated, if you're getting a good regular cleaning and keeping that oral hygiene up, you're going to have a tendency to have less of a problem with it besides that. But there are whitening systems, and we actually have one that incorporates xylitol, because one of the biggest problems when people do go into a whitening program or even in the tooth bleaching situation, a lot of times what you do is you dramatically increase the sensitivity of those teeth to it, and the reason for that is that you have the matrix of the enamel of the teeth is like a crystal. You foamed out different particles, and then they're more sensitive to the air and to you know, those changes in temperature and so forth. But xylitol will help increase mineral absorption into the enamel of the teeth, and it will reduce a lot of that sensitivity. So it's an adjunct to a whitening program, but in and of itself, I don't think it actually does whitening by itself.
Can I just jump in with something I just thought of that I just really wanted to say? You know, as a dentist, and I've got a large percentage of my patients on xylitol regimen, and there is a difference. I mean, you can actually, I can tell who's on the xylitol product, you know, that is doing the xylitol regimen by the glistening of their teeth, the smoothness of their teeth, the hardness of their teeth. It's something you really only can see as an experienced dentist. But I I wouldn't be shocked if those of you that are on the xylitol regimen and you really, press your dentist or hygienist, like, how is their teeth? Do you notice any difference? I mean, you can notice a difference. And the teeth just feel and seem, and honestly, this isn't hype, this is for real, that they're just so much healthier. Check that out and press your dental professionals for an opinion on their teeth and the hardness and the smoothness, and it's kind of like a glistening. So maybe if it's not a whitening product, it almost is going to help them be shinier because they'll be less likely to attract plaque, they'll be harder, they'll be smoother, and your dentist can even tell. I can tell.
One thing carrying on with that, if I can just really quickly, is even using a xylitol toothpaste or using the xylitol products throughout the day, but even just the toothpaste at night. One of the things I noticed just after I had started using this is, how when you go to bed, you brush your teeth, before you go to bed, you brush your teeth, and in the morning you wake up and the first thing you notice is a film across your teeth. And you can actually feel that with your tongue. And again, this for the listeners that are willing to try this, if you start using a xylitol toothpaste, and ideally if you're following the regimen as Dr. Kammer said, and throughout the day using it, but primarily even just the toothpaste alone, you'll notice at least a week, within a week after using that, when you brush your teeth at night, you wake up in the morning, you will not notice that film as noticeably when you're using the xylitol toothpaste, again, because that xylitol is having the effect against the bacteria. And that's a very quick way for you as yourself, and doing a quick test besides the dentist being able to notice it. I notice that immediately. I just don't have that film building up, that morning breath, that morning film.
Great. Yeah, that actually answers that next question that I had. How long does it take to really, for someone to maybe notice the difference? So you think around a week, we should be able to notice the difference?
With the toothpaste, definitely within a week. With a lot of the other things, interestingly enough, even the chewing gum, we've noticed a lot of people will contact us, and they say even within a couple of days after using the chewing gum consistently, they'll say, man, I notice my teeth do feel cleaner. I can tell a difference that's happening with it.
Some of the studies that I've seen, you get a huge bump within 30 days of changing that, inactivating that bacteria in your mouth, and that after 6 months of consistent usage, you've inactivated upwards of, I like to say, almost all. Once again, those are my words, but 95%, maybe higher, of the cavity-causing bacteria in your mouth with consistent use of xylitol. That is amazing, and that's why I'm shocked that it isn't a protocol in every single dental office in the country and world. But you wait, because it's going to be.
Right. Great. Well, it's almost time to wrap things up. I just have a couple of final questions. Brian, if you could just just give a quick recap on some other xylitol products that Xlear has, just for those who are not familiar with those products. Could you share that with us?
You bet. And our premier product is our nasal spray and our sinus care line. And that's basically just xylitol in a saline solution. And it was it was developed by a family practice physician who had been looking at a lot of the research that had been conducted in Finland. And the interesting thing, he was looking for a personal resolution for his granddaughter's recurrent ear infections. And one of the things he discovered was that because the nose, mouth, and inner ear are all interconnected, when you have a lot of bacteria in any one of those areas, of course it's going to spill into the other area. And he was looking at a lot of the Finnish research, saw the studies that on chewing gum, and saw that they actually were seeing a reduction in ear infections in children. He developed this product that's just a saline solution, a salt solution with xylitol in it, and putting it directly into the nose, it dramatically reduces the whole bacterial loading in that whole area, and has been very, very good for just building up that upper respiratory help and helping a lot of parents that are struggling with that recurrent ear situation with their children.
Great.
And not only for
Great.
children, but I use that actually every single night before I go to bed. I give myself a blast. So.
And it is so moisturizing besides having the effect against keeping that bacteria from being able to adhere. And yes, it's something that I use on a daily basis as well. No side effects, no medication. You're not having to worry about medicating your child, but you're using a natural system to help.
Right, right. Great. And where can moms purchase Xlear products?
They are available in most health food stores. Again, they'd be available online. We are trying to get further distribution on those. But as Dr. Kammer said, more and more dental offices are seeing the value of this and actually carrying those in their own dental offices too.
Wonderful. All right. Well, it is time to wrap things up. Thank you so much, both of you. It was, there's just so much information here. I'm sure all the mom ambassadors online will, take all this information back and share it with their friends and their group members as they're trying the SparX candy, sampling that with their members. So just wanted to, give it back to Dr. Kammer or Brian. If you have any last thoughts, feel free to share them with us.
Great. Well, we appreciate the chance to be with you. Again, I encourage your listeners to inform themselves. Ultimately, as Dr. Kammer pointed out too, we are ultimately the ones responsible for our own health, and as parents for the health of our children. And the old phrase, the proof of the pudding is in the eating, and this definitely is the case with this type of a product, that you can really see it. And ideally, you've sweetened the pudding with xylitol.
Sounds good. Hey, thank you, Brian. Thank you, Annie. And I just want to mention that if anybody wants more information about the, as a takeaway, the I Brush My Teeth with Sugar article has been very, very popular in the world of dentistry. Take it to your dentist. Take it to your neighbors for just some more information about the power of xylitol. I will email it to Annie, and she can send it on or post it or do whatever you want to get it to your mom ambassadors. I would also say for more information and for your dentist to learn more about the oral systemic connection, the organization, the American Academy for Oral Systemic Health, has a website, and it is aaosh.org. And I would encourage anybody to go there and get your dentist to join that organization as well, so that the mouth health can be the first place to start for whole body health, and we'll work on the front end as opposed to the reparative back end, and get our country out of a healthcare crisis as soon as we can. But we do have to start with the preventive aspect.
Right, right. Well, great. Thank you so much for your time, and thanks everyone for taking a little bit of your time today to join us on this call. So I hope everyone